So we've seen how to put a foot bandage on the video and using obviously our sterile dressing, but there is a potential for being out and about with the dog when they slice through a vessel and there is a reasonable amount of hemorrhage and you need to stem that hemorrhage. It could be severe hemorrhage. What do you do under those circumstances? Well, the primary aim of first aid is obviously to save life, to preserve life. So whilst we don't really want to introduce any infection, if we've no other means of stopping that hemorrhage, we might have to improvise. And if you've got a handkerchief on you, then you would roll it up and place that over the point of the hemorrhage. You can apply direct digital pressure, just putting your hands on that vessel until you can actually get somebody to help you to put something on it that's a little bit more permanent. You can use some pressure in the vessel above. So in the forelimb, it's the brachial artery, which we've got some diagrams showing you where those are. In the hind limb, it would be the femoral artery, so we would be putting some pressure above here to slow the hemorrhage. But if we're going to put a pressure bandage on and improvise, as I say, a handkerchief, a hair scrunchie, a sock, and that needs to be kept in place with something. So again, thinking outside the box, you might want to put that in place with your other sock and then pop a scarf around there, or you might have some other material on you. For example, ladies might have some tights, so you could wrap that round to fashion a bandage. The idea is that you're trying to exert pressure over the point of the hemorrhage, and rather than holding something flat, it tends to be better if you can roll it up so that when that bandage or that bandage that you're fashioning goes on top of there, it's exerting pressure on. Always leave a bandage in place if you see blood seeping through, because if you remove the bandage and start again, you're going to destroy any blood clot that has formed, and the body is marvellous in the way it tries to preserve itself. It will have formed a clot, and if we take that dressing off and pull it away, then that clot is going to come with it. So never remove the bandage, leave it in place and just perhaps put another layer of something over the top. Be careful that you're not creating a tourniquet with whatever you put on there, but that would be a way of improvising how to stem a hemorrhage when you haven't got the right equipment required.